Assalamu alaikum. Today we will discuss about pelvic inflammatory disease. Pelvic inflammatory disease is a spectrum of the infections and inflammations of the upper genital tract, typically involving the uterus, endometrium, fallopian tubes, ovaries, pelvic peritoneum, and surrounding structure. It is attributed to ascending and descending spread of the microorganism from the cervico-vaginal canal to the contagious pelvic structure, causing the endometritis, salpingitis, pelvic peritonitis, and the tubo-ovarian abscess. Microbiology, these are the organisms that are causing the pelvic inflammatory disease, including the Neisseria gonorrhea, chlamydia, mycobacterium, and anaerobes. Anaerobes including the bacteroides, Streptococcus, and the actinomyces. Bacterial vaginosis occur with PIT facilitating the ascending spread of the pathogen bacteria. Gardenia vaginalis, the Streptococcus, which is anaerobe, causing the PID. The most common cause of the PID overall was chlamydia. In virgin, the PID is caused by the tuberculosis. In postmenopausal women, the E. coli is the most common cause. These are the risk factors that are causing the PID, that are including in the PID. Young age, less than 25 year, multiple sexual partner, past history of the sexually transmitted infection, the termination of the pregnancy, insertion of the intrauterine device in previous 6 weeks, hysterosalpingography, IVF procedure, postpartum endometritis, and new sexual partner within previous 3 months. These are the symptoms that patient they present with the PID. Bilateral lower abdominal pain, which was dull in nature. The onset of the pain is more rapid and acute in gonococcal infection than in the chlamydial infection. Dyspareunia, which was deep fever, unscheduled vaginal bleeding. It may be the postcoital, intermenstrual, or the menorrhagia. The abnormal vaginal discharge. These are the signs that are present in the patient of the PID. The lower abdominal tenderness, which was bilateral, usually bilateral, and axial tenderness and cervical motion tenderness. Clinical diagnostic criteria of the pelvic inflammatory disease. In minimum criteria, which is include the axial tenderness, the cervical motion tenderness, and the uterine tenderness. In additional criteria, the oral temperature, which is more than the 101 degree Fahrenheit, the abnormal cervical mucopurulent discharge, hard cervical friability, the presence of the abundant number of the white blood cells on the saline microscopy of the vaginal fluid, the elevated ESR, and elevated CRP. The laboratory documentations of the cervical infection with the Neisseria gonorrhea are the chlamydia. What is the definitive criteria for the pelvic inflammatory disease? It including the endometrial biopsy with the histopathological evidence of the endometritis. The transvaginal sonography are the MRI technique showing the thickened and the fluid-filled tubes without free pelvic fluid or tubo-ovarian complex, and the Doppler study suggested the pelvic infection. Laparoscopic finding consistent with the PID.